Hello guys, I am first year student of BPT, Bachelor of Physiotherapy at Marwar University, and today I will making a video on brachial plexus for my rubrics video or rubrics examination. So I will explain briefly that what is brachial plexus and how it works. So brachial plexus is a complex network that originates in the spinal cord and travels down the arm. Three nerves control the muscle of shoulder, elbow, wrist and hand, as well as provide feeling in the arms. Structure of brachial plexus. The brachial plexus is formed by the ventral rami of the lower of the cervical nerves C8 to C5 to C8, and the first thoracic nerve T1. It consists of root, trunks, cords, and we have to go for a roots. The ventral rami of the spinal nerve, then trunk. The roots merge to the form trunks. Division. The trunks divide into the anterior and posterior divisions. Cords. The divisions merge to the form cords. Branches. The cords give rise to the peripheral nerves of the arm. Let's see the functions of brachial plexus. Brachial plexus provides the motor, sensory and inversion of the arm, including muscle control and sensations. Muscle control. The brachial plexus controls the muscle of the shoulder, elbow, wrist and hand. And now we are going for the sensations. The brachial plexus provides feeling to the arms, including touch, temperature and pain. We can see clinical significance. Injuries to the brachial plexus can result in weakness or paralysis. Muscle weakness or paralysis in affected arm, numbness or tingling, loss of sensation of abnormal sensation in the arm, pain in the arm or shoulder. Cause of injury: trauma, birth injuries and compressions. Trauma: injuries from accidents, sports or falls. Birth injuries: brachial plexus injury can occur during childbirth. Compressions of the nerves can be causes. Now we are going for the treatment. Treatment for brachial plexus is depend on injuries, like the severity and local of the injury, and may include physical therapy, surgery and pain management. In physical therapy, exercise to improve strength and range of motion. Surgery, surgical repair or reconstruction of the damaged nerves. And pain management, medication or the other interventions to manage pain. The brachial plexus plays a crucial role in controlling the muscle and sensation of the arm. And injuries to the network can have significant consequences. Now we are going for the importance of brachial plexus. That what kind of importance of brachial plexus in our body? The brachial plexus is a vital network of nerve that plays a crucial role in controlling and function of the arm. It is important to can be understood from the several perspectives, like motor functions, muscle control, voluntary movements. In muscle controls, the brachial plexus innervates the muscle of the shoulder, elbow and wrist and hand, and enabling movement such as the flexion, extension, rotation and grasping. In voluntary movements, the brachial plexus allows for voluntary control of the arm movements essential for the daily activity, works and sports. Now we are going for the sensory function of brachial plexus. Sensation. The brachial plexus provides sensory innervation to the arm, allowing for the perception of touch, temperature, pain and proprioception, awareness of body position and movement. Protection. Sensation helps to protect the arm from injury by detecting potential harm and such as heat, cold and pressure. Now we can see the role of brachial plexus in daily activities. Daily living. The brachial plexus is essential for performing daily activities such as dressing, eating and grooming, work and productivity. The brachial plexus enables individuals to perform various tasks including manual labor, typing and other activities that can require arm movement and dexterity. Thank you. Let me see you the presentation for the brachial plexus that you can understand easily by seeing the pictures and the models of what I make for the video. We can see the presentation for the brachial plexus. Brachial plexus for anatomy and presented by me, Mr. Eric Khan Boloch. Now, divisions and organization. We can memorize by the slogan. The Manonic Randy Travis drink cold beer. It means roots, trunks, divisions, codes and branches. Explanation of three tongues. Three tongues in the three tongues. Superior, middle and inferior. Three divisions. Three anterior, three posterior. And three codes. Lateral codes, posterior codes and medial codes. Now we can go for the branches of the brachial plexus. Terminal branches, musculocutaneous nerves, axillary nerves, radial nerves, median nerves, ulnar nerves and visual diagram. Now this is the in detail insertion and the work and function of the brachial plexus. Component, roots, trunks, divisions, codes, branches and the structures, nerve roots, key branches and function. You can see the uh, uh, details in the PPT. Now we are go for the clinical problems. Common injuries or upper trunk injuries, lower trunk injuries, thoracic outlet syndrome and brachial plexus blocks in anesthesia. Now this is the detailed view of the brachial plexus. You can see easily in detail the root, trunk, division, codes, branches like C5, C6, C7, superior, middle, inferior, lateral, posterior branches, anterior, posterior branches and other things you can see in the detail by the PPT. Now I make my video finish by this. Thank you.